Hi everyone. Today we are going to talk about an introduction to behavioral health and mental health careers of Cabo Las Positas Community College districts. So in this workshop, I will be talking about what is behavioral health, mental health careers, and why it is important. And I will also explain and share about the career pathways if you are interested in having a professional in behavioral health and mental health careers. So today's presentation, this is the presentation overview. So today I'm going to talk about what is the behavioral health fee, and what is the differences between behavioral health and mental health and need for workflows, and also after you finish this kind of behavioral health studies, and is there like any jobs, education. And then I also wanted to talk about Ishkai Certified Wellness Coach state certifications. And if you have any questions, you can let me know or you can ask. So before we talk about the presentation, I just wanted to introduce myself. I'm Nora, and I'm a wellness educator with Diversity in Health. So this is about me. So what is behavioral health? So I just wanted to talk about what is the behavioral health means. Let's talk about. So and also to start talking about behavioral health, I just wanted to talk about the difference between behavioral health versus mental health, and the difference between mental health and behavioral health. So firstly, I just wanted to talk about what is mental health. So mental health is mainly focuses on what's happening internally, like our thoughts, emotions, and psychological well-being. But behavioral health includes mental health, but it also focuses on our behaviors and our actions that affect our wellness. So here's like, I just wanted to give a simple example. So if someone might experience anxiety internally, that is only mental health. But how they respond to that anxiety, where that isolates themselves, exercise, seek support, or use unhealthy coping methods like drinking problems, um, addiction, drug addictions, like falls under behavioral health. So behavioral health is look at the whole picture of how people function and also cope in our daily life. So behavioral health are more broader terms, and also it includes our lifestyle habits and our actions in our daily life situation. So one of the goals in this field, like behavioral health field, is helping people more comfortable asking for support without shame or judgment. So yeah, so that is the difference between mental health and behavioral health. So the next slide is about what is behavioral health, why it is important. So behavioral health is really important because our daily habits and behavior directly affect our overall health and our quality of life. So sometimes small changes can make a huge difference between our daily life situation. So for example, like getting enough sleep, exercising regularly, eat healthier food, like eating a healthy diet. And how about we practicing relaxation techniques like deep breathing or meditation, and also setting routines to help manage our stress, and limiting alcohol or substance use, and staying connected with our supportive friends and family members, and even though with the colleagues. So these behavior can improve stress level, emotional wellness, physical health, and even academic like performance. So behavioral health is really important. So behavioral health professionals help people build these healthy coping skills and also helping strategies. And also importantly, behavioral health is not only about responding to crisis, it's also about the prevention. So, in our daily life, behavioral health is really important. We will go next slide. So this is the facts about some important facts about mental health and behavioral health. So first, we all experience our different levels of mental health throughout our lives. And, as we see in the facts, depression is the most leading cause of disability worldwide, not only in the US. So, and then another fact is over 61.5 million American adults, actually like 23% have a mental health conditions in 2024. And also half of US adults with mental illness received treatment in 2024. So it doesn't like it is not showing all of the mental illness like adults or like youths receive the treatments. And also one in five US youth aged between 12 to like 17 experience a mental health disorder each year. So according to these kinds of facts, it is showing there are not enough mental health professionals or behavioral health professionals to help those who are in need. So if you are interested in working in behavioral health and mental health field, what kind of characteristics do we need to have? So I believe all of us have these kind of characteristics. So I just wanted to talk about the common behavioral health professional characteristics. So the first characteristic is we should be understanding. Like we have like our personal or family life experiences that we all have. And we need to listen actively, and then we are to be a like good listener. And then we need to be flexible and open-minded. And also because for behavioral health and mental health professional, we used to connect it with the resources with the community members. So we need to be a resourceful person. And then everyone, we all know about that, non-judgment is also important, and we should be empathetic. So these kinds of characteristics we all have these kind of characteristics already. So yeah, these are the common characteristics. Okay, and then I just wanted to talk about the work settings. So for behavioral health or mental health professionals, they have different kinds of work settings that we can work. So firstly, we can always work like public, like county human social services. We can work under county departments such as child and family services, foster care, and also homeless support services. And also we can always work like public setting, county departmental behavioral health clinics, like local schools, school districts, like substance use program and detox program as well. And also, behavioral health and mental health professionals, they can also work under nonprofit sections, community-based services like homeless shelters, group homes, social service programs, foster family agencies, and multi-services agencies. So we can always work on like nonprofit as well. And also moreover, we can always work for profit like private behavioral health corporates, like inpatients behavioral health hospitals like Kaiser, outpatient behavioral health facilities, and some therapy offices. And also we can also work under school-based, which is hired by a school district or community-based organization to work in schools, after school, in school health centers, and in classrooms. So for the work settings for behavioral health and mental health professionals, we can work public setting, nonprofit, for-profit, and school-based. So the work setting has different kinds of varieties of work settings that we can choose. Where do we want to work? So let me go to the next slide. So why choosing a career in behavioral health? Before we choosing this one, we should know these kind of things. So behavioral health and mental health jobs in California in high demands, as we have seen in the facts, because they have the need for behavioral health and mental health worker continue to rise. And then they cannot get the efficient support for people who are in need. So HPSA has different is showing like our areas and groups of people and healthcare facilities that don't have enough healthcare professionals to meet the needs. And also health professional shortage areas are especially in need, not only behavioral health providers but also in generally like physical health providers, like caregivers, CNA, any other thing like that. So before we choosing the careers in behavioral health, we should know these kind of facts that in California, they are like a lot of in need for the behavioral health or mental health professionals. So I just wanted to talk about education pathway for the behavioral health providers. So this slide shows the education pathway for someone who wants to build a career in behavioral health. So one thing I really want everyone to notice is this pathway is designed step by step. You do not have to figure everything out all at once, and you do not have immediately become a therapist or get a master degree to enter this field. So I just wanted to let you know, everyone, you can start small, gain experience while, and then you can work while going to school and continuing building your career over time. So let's walk through this pathway together, from left to right. So the first step is the college certificate or transfer program level. So this is often where many students begins their career as a behavioral health or mental health professionals. So at this stage, student can earn a certificate of achievement in behavioral health. So these programs introduce foundational skills like communication, human development, counseling basics, case management, and understanding mental health and social services system for the college certificate transfer program. So this level is really great for students who are like exploring the field and wanting to see if behavioral health is a good fit for us. And after you decided to go back to this kind of program, the next step is the associate degree level, usually around 60 units, 60 college units. Students might study human services or social work. And at this point, many students begin gaining some work experience while attending school. Some students may work in youth programs, schools, nonprofits, shelters, some after-school programs, and community organization. So this is also where students can begin working toward becoming a wellness coach one. So, and also I just wanted to, so for wellness coach number one is basically, it looks like the very entry level for people who are interested in exploring the careers in behavioral health or mental health. And the next steps, I just also wanted to talk about being a wellness coach number two. So wellness coach is really important. So the third step, who already finished the associate degree, at the college sites, and then wellness coach number two, then other step is a bachelor one. So the next step is the bachelor degree level. Student may earn like degrees in social work, human services, psychology, counseling, or other related fields. So at this stage, students are developing more advanced knowledge and professional skills about behavioral health and mental health. So this is also where someone may qualify as a wellness coach number two. And after the bachelor degrees comes graduate school, which includes master degrees programs in social work, clinical counseling, and counseling psychologies. So this is the stage where students prepare for their license clinical like careers licensure process. Then after that, they can finally go into the licensures for LCSW licensed social worker, LMFT licensed marriage and family therapist, LPCC licensed professional clinical counselor, etc. So once they completed those hours that requires for like licensing and pass licensing requirements, they can become like licensed professionals. So these professionals can provide therapy independently if you have license. But one thing I really wanted to emphasize is this: there are many meaningful careers at every level, and each pathways. Not everyone needs to become a licensed therapist to make a difference. Some people love like working directly in community schools, outreach program, or youth services. Other continue towards like clinical counseling or therapy roles. So, the beautiful things about behavioral health career is that there are multiple like entry points and also opportunities to grow over time. So, I just wanted to let you know is you can start with a certificate and you can, gain some experience, and you can work while attending school. And then after you decided to, okay, that is my fee. And then you can transfer a university later and continuing building your career like step by step. So this pathway is flexible and also accessible and also designed to help meet California's growing need for behavioral health professionals. Okay, so this is, actually about educational pathways for Wellness Coach 1 and Wellness Coach 2. So Wellness Coach 1 is the very entry level, but Wellness Coach 2 has more advanced gaining experiences and also gaining like education systems. Okay, so the next slide that I just wanted to talk about is California Wellness Coach certification. So where you can do like, certification program, how you can enter in this role if you are interested, and the requirements and any courses or anything that is available for you. Okay. So now we are going to talk about one of the newest and most exciting opportunity in California behavioral health workforce, the certified wellness coach role. So this role was created by the California Department of Healthcare Access and Information, HCAI, and also known as HCAI. And also the reason this rule was created is because California recognized that there are simply not enough behavioral health professionals to meet growing needs of like children and also youth. And many young people are also experiencing stress, anxiety, depression, trauma, like loneliness, and other emotional challenges, but there are a long wait list and shortage of providers in many communities. So California created the wellness coach role to help increase support earlier and more accessibly. So now let's go through each point of the slides because each one is really important. So the first goal is to increase the overall capacity for delivering behavioral health services to children and youth. Um, so that means we need more people working in the field, more support workers, more mentors, more wellness professionals, and more trained people to connect youth with services and emotional support. So the second point says, serve vulnerable children and youth where they are. So this is really important because many young people may not seek therapy or know how to access to mental health services. So a wellness coach can work in these places where youth actually spend time, such as schools, community programs, youth centers, after school programs, or any communities program. So yeah, so the idea is to bring support directly into community instead of waiting for young people to find help on their own. And the next point is saying engage directly with children and youth through age 25. So wellness coaches often work directly with young people by checking emotionally, teaching coping skills, helping managing stress, any other thing like that. So and also I just wanted to clarify something important is wellness coaches are not therapists. They support the children or the youths with like mental wellness, emotional wellness support, and then they help people to connect with their services. And yeah, so it's basically this role is more likely to focuses on the emotional wellness, not a therapist role. And also, the third point is like build a public behavioral health workforce that is better represent the diversity of children, children and youth in California. And also another thing is they just wanted to fill like workforce gap that exists today, as we already see in the feds, and also it ensure the role is both desirable occupations and then a stepping stone for more advanced role like licensed therapists and professional like counselors. Okay, so before we talk about certified wellness coach the requirements, I just wanted to talk about two pathways, the education pathways and also the workforce pathway. So I just wanted to start with educational pathway. So education pathway is mainly for recent graduates or students who are completing the approved like degree programs. So these degree programs may include social work, human services, or addiction studies. And also the workforce pathway is for people who are already working in roles similar to a wellness coach. So these might be professionals already supporting children, youth, families, and community in social services. In education, behavioral health, and some nonprofit settings. So the important thing is to understand that there is not only one way to qualify. Some people qualify through school and others qualify through working experience. So, now I just wanted to talk about, and each pathway, there are two certifications levels: certified wellness coach number 1, certified wellness coach 2. So for certified wellness coach, through the educational pathway, a person needs free experience for like 400 hours. Sometimes the application may be accepted within like 150 hours completed. They might also need an associate degree from any community colleges in California. And for certified wellness coach 2 through an education pathway, the requirement is higher. A person needs like 800 hours. Sometimes the application accepted with 300 hours completed. They also need a bachelor degree, or maybe higher in any university or colleges in California. So these are the education pathway for certified wellness coach 1 and wellness coach 2. So as I already mentioned earlier, wellness coach 1 is the very entry level, but wellness coach 2 has a more gaining experience and more advanced requirements to be a wellness coach number 2. So now we just wanted to look at about Workforce Pathway. So for certified wellness coach 1, through Workforce Pathway, this is for someone who is already worked in a related role. They might need free experience for 1,000 hours of related experiences and any associate degree of US program, and also for certified wellness coach number 2 and a workforce pathway. So the requirements are also higher. A person might need 2,000 hours of related experience and a bachelor degree from an accredited program. So the difference between level 1 and also level 2 is mainly the amount of education or experience required. So level 1, certified wellness coach 1 is more of an entry level professional certifications. Level 2 requires more education and also more experiences. So it may allow someone to, take more advanced like responsibility. So this is the requirements of certified wellness coach requirements whenever you wanted to pursue these kind of role in California. Okay. So if you are interested in more about, certified wellness coach, you can always go to the link that provided in this slides to become a certified wellness coach, and you can get more information about it. And then if you have like any other like specific things, if you are interested in behavioral health workforce development programs, you can always go into this link to have more information about behavioral workforce development program. And then this one is, I just wanted to talk about behavioral health, like education and career experiences of the school year 2026 and also 2027. So this program, like career experiences and an education program, is created by the Chapel College Behavioral Health Workforce Development program through their behavioral health workforce development program. So the goal of this program is to help students enter or grow in careers related to behavioral health, social work, or human services. And what made this program really exciting is that it is designed for students who may not already have a college degree or a lot of professional experience. So I just wanted to go through the program actually offers. So first, the program starts in the fourth semester of 2026. So it is a 3-semester program, and a student must like enroll in at least like 6 units per semesters. Now like one major benefit is student may receive free textbook and free textbook and tuitions for online social work and human services at Chapel College. And then they might also receive 20,000 living stipend and also support services like counseling, transportation support, etc. And also they can have more reward experience with the host employers, like internship, any other thing like that. And then they might also receive access to supportive services such as academic counselings and basic needs services. They might also receive career coaching to understand the career opportunities in the social work, human services, and also behavioral health fee. And also they might have the opportunity to take career readiness workshops like resume writing, interview preparation, and also they might also receive an individualized education plan. So that is very exciting about the program. If you are interested in these kind of programs, you can always go to Chapel College websites to explore more details about this kind of programs. And then, so I just also wanted to talk about the eligibility. So the eligibilities looks like, so if the students, if the individuals who are currently employed a minimum of 18 hours, total of like 650 hours, working with like in the experience with children or youth in social work and human services setting. So for those people who are, for example, like for those people who are working at one of the community-based organization or nonprofit organization, and the age must be between 18 to 25 year on August 24th 2026. And then they have personal experience with any system like foster care, juvenile justice, mental health, behavioral health, housing, and etc. From like underrepresented groups, first generation college students, bilingual people, and also from economically and educationally and environmentally disadvantaged background, so diverse background. And then if the individual is interested and also able to complete online courses at Chapel College, and courses might lead towards a degree in social work and also human services or behavioral health certificate. The most important thing is individuals need to maintain a 2.0 GPA like average to receive like living stipend. So funds are paid like over 3 semesters. If you are interested in this kind of programs, please feel free to learn more about in these programs, and then you can apply there. Or if you have any questions, you can email to behavioralhealth@clpccd.org about this program. So if you have any questions, please feel free to ask, or please, if you have anything to discuss, please feel free to discuss in this workshop. And your feedback is also really important. So after if you have no questions and no concern about anything, your feedback is really important for us. And this presentation is grant funded, so I just wanted to request a moment to complete the survey for like the program for HKIM programs through distance. So if you have no questions, please feel free to give our feedback to through this link. And if you have any questions or like follow-up questions, you can contact directly to behavioral@clpccd.org, email for like Chapel College. So yeah, so this is the pretty much about this program, and thank you so much for being here, and enjoy the rest of the day. Thank you so much.